Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, Attorney Kim Hegwood of Your Legacy Legal Care, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and our very special guest today is Demi Rizzo. Good morning.
Good morning, Kim.
And so today she is kind enough to come and talk to us about brain fit, and in particular, we're going to talk about occupational therapy because I think a lot of people don't realize there's a lot of good stuff that you can get at home, even, and that can help you, just live better. And so I guess we should probably start off with the basics and tell our listeners what is occupational therapy.
Okay, so occupational therapy, or like we call it OT. It's a form of healthcare. So it's a therapy that it helps people do the things that they need or want to do in their daily life, especially if an illness or an injury, a disability makes that hard. I know when people hear the term occupational therapy, they think, oh, it's work therapy. I don't need that. But the term occupation here, it doesn't mean a job, but really refers to everyday life activities. So getting dressed, cooking, moving around the home, or managing emotions and social interactions. As occupational therapists, we work with people of all ages. We help them regain their skills, adapt to their environment, or find new ways to do the activities so that they can live independently and as comfortably as possible. So it could be helping a child with being independent and comfortable in school, or it could be hand therapy after a surgery. It could be supporting an elderly person safely navigating their environment in the home. So OT is all about improving life by focusing on what's important to that individual.
And so all good things. And
Yeah,
and
they're
so
important.
definitely.
Everyday life activities.
Yeah. So, but how does OT in particular benefit the adult, geriatric, or I guess I should say senior geriatric, just not a nice word, does it?
No, it's not that
So,
nice anymore. So I call it the aging population
there
because
we
we're
go.
all getting older. So we work with adult and geriatrics in the aging population. So at BrainFit, what I like to say is our ultimate goal is to optimize function and increase or improve independence for the aging population. So just some ways in which we do that is improving daily function. So we help our patients with, like I said before, everyday tasks like dressing and bathing and cooking, moving safely around the home. We offer strategies and techniques. Sometimes we offer adaptive equipment to make tasks easier and safer. We promote home safety. That's a big thing that we do. So we can conduct a home safety assessment and recommend modifications to reduce fall risks, which could be something as simple as a grab bar, a toilet commode, shower chairs, or even improving lighting. We train individuals and their caregivers in the home to safely navigate their environment and minimize those chances of any accidents that could potentially happen by falls or not having the proper equipment. We manage chronic conditions. So a lot of our older adults will have chronic conditions such as cardiovascular disease or arthritis, which makes daily tasks really difficult. So we'll provide strategies to manage pain, conserve energy, and complete tasks without overexerting themselves. A big part of what we do is educating patients and caregivers on safe practices to prevent worsening symptoms. What else? We support cognitive health. So for those patients that might be experiencing memory loss or cognitive decline, like in Alzheimer's or dementia, Parkinson's, we help by creating routines, using memory aids, developing coping strategies to support independence. We also educate caregivers to better support their loved ones. And I'll get into it a little bit later, but we have a very specific training program that's only delivered by occupational therapists called Skills to Care. So I'll share about that a little bit later. But some other things that we do is we enhance social and emotional well-being. This could be feelings of loneliness, depression, or anxiety. So the ways we help in that is by staying engaged in meaningful activities and social interactions, which those meaningful activities are so important for aging. It gives you a purpose. It makes you feel like your life is still worth living, even though you might have a chronic condition. And we adapt activities to suit their current abilities and finding new hobbies that might bring them joy and connection. Let's see. We aid in adaptations to physical changes. So as the aging process evolves, our body changes, our physical, social, emotional, everything is changing. So we like to find ways to adjust movements or use those assistive devices, like I said, walkers or canes, to safely and confidently get through your day. This adaptation, it helps older adults a lot by keeping them involved in the activities that they love.
So let's kind of slide a little sideways for the minute,
Okay.
and let's dig a little deeper into the sort of treatment that y'all are offering for brain fit for people that
Yeah.
have dementia or Alzheimer's.
Yeah. So our Brain Fit clinic, it offers a wide range of treatment for dementia patients and Alzheimer's. Our main focus is maintaining independence, ensuring safety, and enhancing quality of life. That's really our um, what our main goals are. We really want to improve quality of life for the patient, and then a caregiver if a caregiver is involved in that. So we create custom treatment plans, and they're tailored to the unique needs of each patient. And a lot of them will include something like cognitive stimulation and memory aids for those patients that might have dementia or Alzheimer's. So engaging patients in activities that stimulate memory, require attention, problem-solving tasks, as well as introducing memory aids like calendars or labeled photos, or breaking down step-by-step instructions that will help with daily routines and really reduce any confusion. And as I mentioned before, we do daily living skills training. So we help dementia patients maintain skills like dressing, grooming, eating by working on those fine motor skills, those breaking down the tasks for them to make it easier. Sometimes we will give adaptive equipment like a button hook or a weighted spoon eating utensil to make those tasks easier. We make tasks more manageable by breaking them down. We ensure activities aren't super overwhelming for the dementia patient, making them more achievable, setting them up for success so that they don't feel overwhelmed and then could potentially have some sort of behavior as a result. Two big things are home safety assessments and environmental modifications. I touched on them briefly, but we actually go into the home. We assess every aspect of the home, from the floors to the lighting to the banister, to see if it potentially could break and cause a fall. We adjust the home and modify it by decluttering it, making the necessary items more visible to the person with dementia, so that, again, it decreases any frustration that could potentially lead to a behavior or wandering, eloping. And then, as I just mentioned, behaviors. We do a lot of behavioral management techniques. So as we know, dementia can lead to anxiety, agitation, aggression. So our therapists, we teach patients, and if we have the opportunity, their caregivers, techniques to manage these behaviors, like setting calming routines, engaging in meaningful activities, and recognizing early signs of distress. And then the physical component comes into it, the motor skills, which are a big thing, a big decline that happens in some of these aging disorders. So we work with dementia patients to improve and maintain where they're at, their physical abilities. So this could be balance, hand-eye coordination, coordination, agility, through gentle exercises that are specific to them and where they're at physically. And not only do we really improve the mobility, but we also reduce the likelihood of falls and physical deterioration. So we will assess them fully to see if there's any risk of them having a fall risk, and then work on all of those components that go into decreasing the likelihood of those happening. And then another really big component is the social engagement part and the leisure activities. A lot of the people who we see will be retired. They're at home. They don't have a lot of stimulation in their life. So We like to engage in meaningful activities and help maintain that mental health connection to their surroundings. So we use personable and enjoyable activities like music and art, creating scrapbooks, just to keep them engaged and stimulated, because that can also really help with decreasing any boredom or depressive symptoms.
Perfect. So you
Yeah.
mentioned earlier about skills to care.
Mhm.
So what is that?
So Skills to Care is a occupational therapy based caregiver training program for persons with dementia. So it is a program that is designed to help caregivers effectively communicate and support the dementia patient. This training includes strategies for managing difficult behaviors, um, reducing stress, enhancing the safety and quality of life for the person with dementia. And the bigger part is the caregiver. We want to improve the quality of life for the caregiver, get them back to doing what they were doing prior to becoming a caregiver, because we know the caregiver burden that a lot of these caregivers feel when they take on another role as being a caregiver for a person with dementia. So there's a lot of components that goes into skills to care. But one of the things that we work on is behavioral management. So we teach caregivers how to handle challenging dementia behaviors, such as agitation or wandering, inappropriate behaviors, even like sexual innuendos. So we do this by identifying triggers and applying compassion and calming responses. So we teach the caregiver how to be compassionate and how to respond in a calm, appropriate manner, which can reduce the reaction from the person with dementia. As I mentioned before, we also do home and safety environmental modifications. So in one of the first 2 sessions that we have with the caregiver and the person with dementia, we'll go into the home and we will assess every aspect or every area that the person with dementia will be residing in. And we see if it's cluttered, if it's overstimulated, if it's unsafe. And we'll make recommendations and changes to make the living environment more accessible and less overstimulating to the person with dementia. And then we approach improving communication. So we go through communication strategies with the caregiver, and in the pre-assessment, we ask them what are the ways in which you communicate right now. Do you use a gentle tone? Are you a little bit louder than you should be? And then we offer modifications to how they're approaching communication styles with the person that they're caring for. We also create routines and, again, meaningful activities to keep them stimulated. So we support caregivers in establishing daily routines and activities that match the individual's abilities and interests, which overall can reduce that anxiety and improve engagement. And then the big piece that I mentioned is for caregiver self-care and stress management. We teach stress management techniques and emphasize self-care and self-love for the caregiver, because if the caregiver feels as though they're taking care of themselves and they're in a good place, it will make taking care of their person a lot easier and a lot more meaningful. So we want to reduce caregiver stress. We want to improve the well-being of both the dementia patient and the caregiver, and delaying the need for more intensive care. Skills to Care it's an evidence-based, theory-driven training program that has been proved to improve the quality of life for both the dementia patient and the caregiver, and delay the need for more resources or going to more of a assisted living home.
So it sounds like the training is done at your home, like in your own environment, and it's very individualized, which is awesome.
It
And
is, yes. So it is very individualized. I'm being completely transparent. It is a very in-depth, rigorous conversation with the caregiver. We ask them every single possible question about what they're doing, what they're experiencing, when they experience it. Are there other people around? Is it a certain time of day? Because we really want to get to what is what is the caregiver experiencing? Why are they experiencing it? What are some brainstorming activities we can come up with to approach it in a new way? And then we develop an action plan on how to actually implement those strategies. We don't just say, hey, go do this and see how it happens. We come up with 3 to 12 strategies, and then we implement them. And then the next session, we see how those things improved or didn't work. And we just keep trying new strategies that the caregiver hasn't tried. And more times than not, we get back and it's like, wow, that strategy really worked. And it was something as simple as putting a visual on the refrigerator for the person with dementia to see, this is how you make your cereal in the morning, step by step. And that decreased the frustration of the person with dementia, which improved the communication with the caregiver. So it's a really great program. And right now it's just not well known about. So that's why I'm here with you to get the word out about skills to care and what we're doing at BrainFit. Well, and yes, you mentioned it's a in home. So it's actually we have a couple different ways to actually deliver skills to care. So a couple ways that it's done. We definitely go into the home, and that's kind of the first or second session so that we can assess the home and do that environmental modification if necessary. We can have patients and their caregivers come into the clinic so that we can also work on other skills like the physical challenges or the memory, cognitive changes. And we can also do a hybrid model. So we can also do it through telehealth. So a lot of my patients, what I'll do is the first session, I'll go into the home. We have a sit down. We go through all of the problem behaviors. I assess the environment. We also do a physical therapy screen to see if they actually are a fall risk. Even if those aren't a problem, the caregiver's not describing it as a problem, we like to do a formal assessment just to see if a fall risk might be on the table, and then we would refer to physical therapy. So we go into the home that first session, and then we kind of see what works best for the caregiver and the person with dementia. And sometimes the caregiver is like, I would prefer if you don't come into the home because it might agitate the person with dementia. Let's do it through telehealth. Or I would like to get my mother or father out of the house. Let's go into the clinic and do it in the clinic. We'll sit down, we'll have a coffee, and we'll chat. So we have a couple of different ways of delivering skills to care.
So I'll be honest with you, it sounds expensive. And how do people pay for this?
Thankfully, it is covered through the person's Medicare Part B insurance. So even though the caregiver is receiving the skills to care training, the person with dementia is involved, which allows us to bill Medicare for the therapy. Now, the occupational therapy and physical therapy are generally covered through most insurances. So even a commercial insurance, Medicaid, they will cover caregiver training. And that's what we bill it as, a caregiver training program. So it will be covered through Medicare Part B. It will be covered through commercial insurances and Medicaid. And then if for some reason insurance is not accessible, then they could do private pay, and we could come up with some sort of payment plan if necessary. But I've had very few, maybe one time in insurance companies, like we had to rebuttal it. So we had to kind of write like, this is why this person needs this, and this is why you should approve it. And it got approved. So it is one of those things that insurance will cover.
Good. Perfect. See, that sounds like a plan. If Medicare's paying for it, I'm all in, right?
Yes, exactly. Right. Yeah, I'm very thankful. They recognize it as medically necessary. So insurance is on board. So that makes us happy.
I think we're getting to a point where people are realizing that the more proactive things you can do lessens hospital stays, lessens, having to leave the home and things like that, where your cost of care gets to be more expensive. But Demi, I know my listeners are really going to be excited about this. So how do they find you?
So there's a couple different ways. You can go to our website, brainfitot.com. You can email me personally, demrizzo@brainfitot.com, or you can call our office, 832-303-9849.
So, well, this sounds like a really awesome program. So I'm looking forward to our listeners getting to have a chance to meet up with you.
Yes, thank you, Kim. I was very excited when I got this email about being a guest. I think this is a great platform for caregivers, medical professionals, and patients just needing extra help and resources and finding out what else is out there than traditional doctors and kind of trying to figure it out on your own or going to assisted living facility. Aging in place is a thing, and it's definitely accessible.
There you go. All right, girl. Well, it's been a pleasure having you on the show. We look forward to having you on again soon.
Thank you so much, Kim. I appreciate it.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.